I am a nurse in the community, so I'm here to hear about what health things are going on in Wichita.
I'm involved with the healthcare in our community quite a bit, so the more I know, the better off I'll be.
As a young person, I think sometimes it's hard to be really politically engaged. There's not a lot of opportunities, especially in Kansas.
Our next panelist is David Geer, and David Geer has actually been the executive director of the Guadalupe Clinic for 2.5 years. The Guadalupe Clinic, how many of you are familiar with it? Oh, good, okay. Well, for those of you who don't know, it is a donation-based primary care clinic that has been providing health care in the region for 30 years and never turns away those in need. If a patient asks how they can help, a $5 donation is suggested. Staff and volunteers delivered 25,656 medical primary health care services in 2014-2015. David has more than 40 years of healthcare experience, including time spent as a flight paramedic with Wesley Life Watch Transport Team. David earned his undergraduate degree in health science from Wichita State University, College of Health Professions, and his Master of Health Science degree from WSU. Let's have a warm welcome for David Geer.
Well, with an introduction like that, you have to say, go Shockers, right? The downside of that is I graduated from KU with my paramedic license, so I have to be both sides of that world. But it's a good world to be in, and I feel really fortunate to be in the state of Kansas, although I don't know all about the state that Kansas is in, and I think that's what we're here to discuss this evening. My take on this is I'm a real rule follower, so when I got the directions on what to speak on, I listed those, so I'm going to follow the rules and stick to the script here, but I think it's pretty much unscripted as far as where we need to go, and there's some experts on the panel here that are really going to map that out for us. Before I get started, I'd like to thank Debbie and Sarah Jane and all the KMEW staff for putting this program together this evening. And for all of you for filling the house and being interested in what healthcare has in store for the state of Kansas and what Kansas has as far as in store for all of you. Might I take a quick survey of how many of you all in the room have healthcare insurance of one form or another? Okay, so let's do it the other way. How many of you all in the room do not have healthcare insurance? Show man that served me my coffee. A few other hands go up. Okay, well that's a helpful piece to know. How many of you all in the room have Medicare? Okay, and Medicaid, and private insurance. Okay, private insurance, there we go. All right, well, I'm going to cover 4 topics in my 10 minutes, and I better make sure I'm on task with that, being the rule follower that I am. And those 4 topics are the faces of the uninsured of Kansas, how do healthcare laws affect me personally, reducing the barriers to healthcare access, and what is at stake of the future of healthcare in Kansas. I'd like to start off with the faces of the uninsured because I see them walk through the clinic every single day at Guadalupe. For 30 years, we've served people without healthcare insurance, the homeless, the working poor, the underemployed, and the unemployed. During the Year of Mercy in 2016, as part of the Catholic Church, we at the Guadalupe Clinic, our 3 clinics, will continue to provide primary health care to the medically marginalized of our region, the undocumented, the homeless, again, the working poor, and the unemployed. In Sedgwick County alone, it's estimated that the number of uninsured is between 70 and 75,000 individuals, and that doesn't include the undocumented of our community. There is some that say that it does, but if you're undocumented, we're not quite sure where you are, and so therefore there's a little bit of leeway there. The latest data released this week is that there are approximately 150 uninsured in the state of Kansas. So if we do the math, about half of the people that are uninsured in the state of Kansas reside right here in Sedgwick County, and a few of you that are in the room this evening. So who are the faces of the uninsured? They may be sitting right next to you, or this gentleman that's serving us coffee this evening. They may be your neighbors. If you walk around Old Town in Wichita, you'll encounter them. By and large, the street people of Wichita. How do the healthcare laws affect me personally? This is a really easy one for me because I personally have been impacted by the Affordable Care Act. When that came into law, my son was living with us, Noah, and he was able to be covered till he was 26 years old. Well, shortly after his birthday, he no longer was eligible to be part of our health care plan. And thank goodness for the ACA, because he was covered till then. Shortly after he turned 26, he had a medical incident where he had to go to the doctor, our primary care physician, and then he had to go to the hospital, and he had a lot of x-rays, and he had anesthesia, and he had surgery, and then the medical bills started coming in, and they're still coming in. So we are now part of that uninsured family. And you're going to hear a lot about how we need to take care of my son Noah, as well as a lot of other people in the room, because he is a restaurant worker. He works at a local restaurant here in the community. And so he's caught between that donut hole. He's in the can't afford ACA, but I'm not poor enough to be on Medicaid. So there we go. That sets the stage for my other two panelists, because they're going to go into that extensively. As you will hear this evening, and I like the shirt that this lady in the third row has on, please stand up. Medicaid needs to be expanded for all the right reasons. How we go about that, Sheldon will go over with you to full extent, so I'm not going to. But until then, the Guadalupe Clinic and the other safety net clinics in the community of Sedgwick County, as well as throughout the state, are helping cover those that can't afford can't afford the ACA and cannot be on Medicaid. And we're blessed in Sedgwick County to have a network of safety net clinics that operate on a sliding scale. Health Corps, which Teresa's with to my right, Hunter, Grace Med, EC Tyree, to name a few of the clinics. And then we have a few donation-based clinics like Guadalupe. Mayflower is one of them, and there's a couple of others that are open occasionally throughout the week here in Sedgwick County. So you all know, since everybody didn't raise their hand, Guadalupe Clinic does not accept insurance. So if you're insured, we would refer you to one of the other safety net clinics. And those that can't afford the Affordable Care Act, if they bring us their records of how much they make, then we refer them into the ACA, because it's a great program. And we have many patients that once they reach that threshold, they ask us, well, why can't I stay at Guadalupe? I want to stay here at Guadalupe. I like my doctors. The answer is no. You can afford to be in a wonderful system that provides everything that you could possibly need, whereas Guadalupe patients, they have to wait for health care sometimes. They have to wait for some of the things that I'll go into here shortly. So we're going to travel down the path of what it's like to be a Guadalupe Clinic safety net patient. Our three clinics are donation-based. We are 501c3, and we serve all faiths and backgrounds. Our mission is serving the uninsured and underserved with compassionate health care. And we provide that help without any assistance from any of the insurance companies through grants and donations. And we have a very active grant writer. no Medicaid, no Medicare funding, and of course we do not participate in the ACA. Because we have a small staff, we have a whole different medical care provider system. We have more than 270 medical volunteers that donated in excess of 6,500 hours last year. That's how we can afford to ask our patients for a $5 donation to receive everything that they need, and no one is ever turned away. A little bit different healthcare model. So how do we reduce the barriers to healthcare? Well, let's discuss a little bit about what are the barriers. Some of you in the room that raised your hand that don't have insurance, you know what the barriers are. When I had to have surgery on my ankle, I went to my primary care and he sent me to an orthopedic specialist, and I had x-rays and I have everything I needed. So let's go down the path of how we are going to remove some of these barriers. So what's the first barrier to most people accessing health care?
Money.
Dollars, the cost. Thank you. So that fear of that cost is what discourages people to come to Guadalupe. They have no idea what it might cost them. Once they get through the door, the fear is, what if something's wrong and then I have to have additional care? What happens if I have cancer? What happens if I have liver failure, kidney failure? All these things are barriers to people walking through our door. I'm going to tell you a quick mission moment, because we're going to put a face on these folks that need health care, besides my son Noah. A patient was walking out of the clinic the other day, and I asked her why she was crying. And she said, well, these are happy tears. And I said, really? I said, come to my office and tell me about happy tears, because I thought she was dissatisfied or unhappy with our care. And she came in and she sat down and she said, you know, I spent an hour in my car crying before I came in because I lost my job. And because I lost my job, I lost my health insurance. And for the past 2 years, I've been uninsured. And because I got sicker and sicker, I couldn't apply for a job. So I finally dried my tears and came into the clinic. And she said, the reason I was crying when I left is because I was treated with compassionate care and at no fee. And I didn't know there was such a system in place. I followed her and continued to ask her story, and it turns out that she had a lump in her breast, and we entered her into the Early Detection Works program, and she ended up with a breast biopsy, and then she ended up with a lumpectomy, and then she ended up coming back and telling me her happiest news of all, and tears of joy, that she probably was just going to have radiation and no chemo. So this is the face of the poor. And I think that that's a real testimony to the system that's in place. When you enter Guadalupe's doors, you receive your lab, your x-rays, you receive everything that you need. And if we can't provide it, there's a system in place in Wichita that we're really blessed with in Sedgwick County called Project Access. This is a team of doctors and nurses and hospitals that provide all their care for free. It's one of 4 systems that I'm aware of throughout the state. 4 counties are covered. The other counties in Sedgwick County don't have any system in place like that. So we have a very generous healthcare community. Again, reducing a barrier to healthcare, hospital costs. Transportation. Believe it or not, there's a lot of people that can't get to the doctor. So we provide that transportation with bus passes. We provide the transportation with taxi fare. These are simple things that we don't think of because we get in our cars and we go wherever we want. Transportation. We have patients cancel their appointments because their car won't run. So we send somebody to get them. And then there's the whole issue of behavioral health care, and we're faced with that as well. A limiting factor for our severe and persistently mentally ill people that can't access health care because they themselves won't allow that. And then there's another area of changing the attitudes, values, and beliefs of our community. That it's free if I'm on Medicaid. It's free if I'm on the ACA. It's a free system, but ladies and gentlemen, we all know there's a cost. The cost was just outlined by the previous speaker. So who will pay? Who is going to pay for this? Because it all comes at a cost. Is it cost shifting? Is one population going to be taxed for paying for the other? The Kansas Health Foundation and the Kansas Health Institute just had a group in speaking about the Indiana model. If you didn't hear that or see that, I suggest that you contact them and they can provide a transcript for it, because Indiana was just able to work through the legislature and with a Republican governor and actually expand the system to include a lot more people in the state of Indiana. Barrier number 5 is undocumented individuals in our community. The U.S. Census American Fact Finder estimated there are over 24,886 non-United States residents in Sedgwick County. But we have 497,000, so about 2.5% of Sedgwick County residents are non-citizens and have no health care coverage. They're not eligible for Project Access, they're not eligible for Medicaid, they're not eligible for Medicare. This is the face of the poor. So the reduction of the last barrier I want to mention before I pass this on is, again, Project Access. The fear of not being able to afford specialty care beyond Guadalupe Clinic is Project Access. MRIs, CT scans, heart caths, coronary artery bypass grafts, orthopedic surgeries, that network of volunteers that I mentioned. And the state of our future of healthcare, the 4th item, it's reducing the infant mortality rate, the rates of obesity, diabetes, and all the factors that cause these public health problems. And the ability to change individuals' values, attitudes, and beliefs that they should have a healthy lifestyle, that each of you should have a healthy lifestyle. Stroke prevention, hypertension prevention, all these things we need to look at as a healthcare community to reduce the population that needs tertiary care. And the last one is the rising rates of suicide, drug addiction, and overdose, which are being addressed by the safety net clinics throughout the state of Kansas, and specifically by Guadalupe by offering integrated behavioral health care. We have a group called Kidney Counseling. ComCare has a group coming in. Sedgwick County ComCare is connected with Grace Med. Health Corps has behavioral health care folks coming in. And that is an integrated behavioral co-located model that needs to be in place to serve the populations to help decrease the individuals seeking medical care for a lot of reasons that possibly they don't when they have severe and persistent mental illness. In closing, it's because of generous donors of their time and talent that Guadalupe can do what we do. Along with primary care, our patients can also be part of a wellness clinic, a diabetes clinic, dermatology clinic, an allergy clinic, a cardiology clinic. These medical volunteers are doctors, physician assistants, APRNs, RNs, LPNs, medical assistants. We have a group from KU School of Medicine, KU School of Pharmacy, the Wichita State University APRN program, and a lot of other schools and colleges that participate. And we also have many lay volunteers, like all of you in the room, that participate in a program called Sissy Donovan Helping Hands. Thank you again for your time and attention to the quality of healthcare of the people of Sedgwick County and Kansas. Have a voice, please register and vote. God bless.